All right, let's get into our first discussion now. The Nigeria Center for Disease Control has announced that the total number of confirmed Lassa fever cases has risen to 61, with 16 deaths recorded.
Indeed, the agency says 107 suspected cases of the virus have now been recorded in 10 states. They are Edo, Ondo, Bauchi, Nasarawa, Ebonyi, Anambra, Benue, Kogi, Imo, and Lagos. The center also said it is collaborating with the WHO and other agencies in supporting the response in the affected states. Well, the Chief Executive Officer of the Nigeria Center for Disease Control, Dr. Chikwe Ihekweazu, is joining us now via Skype to talk more about the efforts of the government so far to curb the spread of Lassa fever. Good morning to you, Doctor. Yes, about 16 people we understand are dead, but what are the efforts being put in place now to ensure that those infected are well treated, because we understand there is no vaccine?
Yes, so good morning, and good morning, Nigeria. I think the efforts being made are being made on multiple levels across the country. I'll address this in 3 levels. Firstly, we're making massive efforts together with the state governments to really enlighten Nigerians about the risks of Lassa fever again, really saying that this disease is caused by the transmission of a virus from rats to humans. So the most important message for everyone today is to limit access of rats to our foodstuff. Now, and environment, if you go across every Nigerian city today, you see heaps of refuse. If you go around the homes and near the streets, you find heaps of refuse everywhere, and we're all basically inviting rats into our neighborhood. So we all have to keep our environment clean and limit access to rats from where we're living. Secondly, is the efforts being made by the states to identify by healthcare facilities to identify and treat Lassa fever. Now, Lassa presents like malaria or any other disease that would cause a febrile illness. There's no way of immediately differentiating Lassa from malaria. So we're really encouraging doctors across the country to please use the malaria rapid diagnostic test. It's a very simple, a very effective way of diagnosing malaria. So if it is indeed malaria, we can go ahead and treat. And if it is not malaria, we can now start thinking about other possible causes. The third critical message, especially for healthcare workers, is to always use universal precautions. You do the basics. Use your gloves, use protective equipment, depending on where you're working. Don't take anything for granted. So please, there are many things we're taught in medical school that many of us don't practice anymore. Please use those precautions. They will not only protect you, but they'll protect your patient and ensure that we work in a safe environment. The first ethos of a medical doctor is do no harm. So please do what you can yourself, advocate to the leaders of your teaching hospitals to do the same, and let us work in a safe environment. So I think those are messages today for Nigerians.
Okay, besides the message, the point there is this disease, it seems to appear and reappear every year, and Nigerians are still not used to it. What is really in the core? What is really in the core of the reason why we know that when it comes to a certain period of the year, Lassa fever is going to show up?
So actually, if you look at our data at the Nigeria Center for Disease Control, we've demonstrated that Lassa actually happens throughout the year. However, there are periods in the year, like the dry season, especially now, where there's an increase in incidence of Lassa because, you know, for various reasons, rats are more around our environment and there's a higher risk of contact. But I really want to, you know, this is a disease where the virus resides in a vector, in a host, the rats, the multi-mammate rats that are ubiquitous in our environment. So it will be very difficult to completely control until we have an effective vaccine. There are lots of efforts going on in the scientific community at the moment to develop a vaccine, but we're not there yet. So at the moment, the tools that we have are the old public health tools of prevention, early detection, and management. And I do think, even if we're not able to reduce this to 0, we can really reduce the incidence of Lassa in Nigeria if we carry out these basic measures. But, you know, definitely we have to up our game. We have to up our game as a society. We have to up our game as healthcare professionals, realizing the risks that we face every day.
Talking about the need to up our game in the country, why does it seem that the health sector now, not even the practitioners, but the health sector and the Nigerian government don't seem to be prepared for recurring endemic diseases like Lassa fever, meningitis and cholera that we've somehow now understand reoccur almost every year?
Yeah, so I think the federal government is doing a lot in this regard, at least. This week, we're starting the biggest yellow fever vaccination campaign that we've ever carried out. 25 million people, Nigerians, will get vaccinated. Actually, this is a vaccine that every mother should take their child in for vaccination in childhood. So the reason we're having this campaign is because we have not been doing that. So there's so much the federal government can do. We have to take a responsibility as well for our health. The cholera is mostly a waterborne disease. The government and all other stakeholders are really trying hard at all levels to provide clean water, but we also have a responsibility in this regard. It's the same as Lassa. So over the past few months, we've been working across the country on meningitis in the Northwest, on Lassa in Ebonyi State, Edo, and all those states. Yellow fever now, a campaign is starting. So really, government, in this regard at least, is doing everything possible. But there is no magic bullet. There's simply no magic bullet for cholera. There's none for Lassa. For yellow fever, that there's an effective vaccine. But we're now calling on Nigerians to come and join us in this effort. Do not wait for government to solve all the problems. There are many things that we can do on ourselves. Let us all do our bit. Rest assured that government is doing everything possible at the moment. This federal government has prioritized health more than ever before, especially public health. You've just seen that the bill for the establishment, the legal mandate to the Nigeria Center for Disease Control has just gone through a public hearing. So there's a lot of focus in getting disease detection and response architecture ready to work for Nigerians. But I'm really appealing to Nigerians to also do their bit in protecting themselves, keeping the environment clean, washing their hands. Keep these messages in mind that we're all doing during the Ebola outbreak. And we seem to have all stopped suddenly and looking for some magic bullet that will save all of us. So I'm really appealing to Nigerians to do their best. I'm appealing to doctors to remember universal precautions, and they can rely on us for the support.
Doctor, when you have said that a lot of medical practitioners are also not carrying out the precautions, and they are the ones who are supposed to even be more aware. So if they are not aware that much, or they've let down their guard, how much more Nigerians? But let me ask you this question. You talked about the massive enlightenment campaigns going on. Can you share with us what strategies are being used to enlighten Nigerians and what agencies you're collaborating with so that Nigerians can really follow what government is doing in that regard?
So the strategies are to reach Nigerians by any means possible. So if you go around the states, you will hear messages in local languages on these epidemic-prone diseases, Lassa, yellow fever, meningitis, working primarily with this is supported by UNICEF in terms of risk communication, and working with the Nigerian orientation agencies, the state governments, to translate these messages into local languages. I've made several media appearances like I'm making today, as well as my colleagues across the country. We're on social media, so we realize that people access information through different ways. So we're using everything possible. If you go on our website, you'll see information. If you go online, you'll see information. So there's no single approach to this. Our strategy is a multi-pronged strategy using all communication channels at our disposal to ensure that we reach as many Nigerians as possible. We also have in local government, local community mobilizers, many of them working for one program or the other. For instance, the polio program. What we have done is now support them with extra messaging for meningitis, for yellow fever, so that we can use the same people that have been employed and recruited for one disease to really help Nigerians respond to all this.
All right, let me just follow up on this. How have you measured, or how effective are all the strategies you have put up now from your measurement and from your assessment?
So it's very difficult to measure, but you can see the level of awareness among Nigerians around this disease is constantly increasing. So we get very critical questions. We are asked all the time about what we're doing, And actually, I personally take that as a sign of encouragement that Nigerians are actually finally engaging on these issues that matter to all of us. Previously, health has never really been high enough on the agenda in our political space. You know, we worry about security, we worry about roads, power, electricity, but, you know, nobody has ever talked about what health. No politician is ever asked about what is he going to do in the health sector. So I think what we're doing now is really raising the consciousness of Nigerians around these things. You know, government has to prioritize. They prioritize according to what Nigerians are asking for. So the more pressure Nigerians put on our government, the more they'll prioritize health, and the more we will be empowered to do the necessary and carry out the necessary actions to protect their health.
Okay, now talking about the yellow fever immunization process that you told us earlier would begin pretty soon or has begun. We understand that about 4 states, Kogi, Kwara, Zamfara, and then later on to Borno, making 4 states would benefit from that immunization process. What about other states of the country? Because what we usually see is that when there is an outbreak of an epidemic or in any region of the country, what happens is that that particular region is given attention and people there are given immunization. But what about the rest of the country?
And people are mobile.
Exactly, and people are mobile. Don't you think that could be one of the causes of this problems?
No, we're starting from these 4 states. It's not the end point. So, you know, carrying out immunization campaign is a huge logistical exercise, because we have to start at the same point in every health facility, in every local government across all 4 states. So it's a huge logistical exercise. We mobilize health workers from all across the country to come in and support these 4 states. So the 4 states are the starting point. We will then proceed to all the other states until we reach, until we cover the entire country. Really, this is the strategy that we're employing. But we can't start from Nigeria. It's a huge country. We don't have the resources, the capacity to start at 36 plus 1 states. But our sister agency, the National Primary Healthcare Development Agency, that is actually leading on this, they're absolutely determined, their leadership is determined, and they have really made this a priority to push this campaign forward in order to protect Nigerian children.
All right. The Minister of Health has said that that he has called that every case of fever should be investigated before investigated for Lassa fever before treatment is carried out. What could be the challenge in making this happen across the country when a lot of people are aware that the facility are not on ground the way they're supposed to be, especially in many rural areas across the country?
No, I think the minister has been slightly misquoted on that. What he actually said is that every case, every febrile case should be investigated. Okay. The first investigation is actually for malaria, because that is the most common cause of fever in our environment. And once you've ruled out malaria, then there are other common causes. There are a lot of bacterial illnesses, urinary tract infections, respiratory infections that are then investigated. If that's the cause, then they're treated appropriately. In children, for instance, the most important secondary cause would be a respiratory tract infection. But once you have that and you've ruled out malaria, you've ruled out a bacterial infection, and you still you're still having fever, then you collect a sample and send to a lab. At the moment, unfortunately, there are only 3 labs that are able to make the diagnosis of Lassa fever in Nigeria. One is the National Reference Lab in Abuja. The second is the Irua Specialist Hospital in Irua in Edo State. And the third is at the Lagos University Teaching Hospital. Now, one of our priority actions over the next year is to increase the capacity and to ensure that at least in every geopolitical zone, for starters, that we have a lab that's able to diagnose Lassa. There's no simple test for Lassa, so it's not like there's a rapid test or something you can simply plug in and get the result. It's a complex mechanism and arrangement. It's called molecular diagnosis, or PCR, for Lassa fever, and it's very complicated to set up and to run. So it requires a significant capital investment, which we're looking we have included in the next budget for NCDC and looking to roll out in the next financial year. And
I was about to ask that question because after the deaths of 2 doctors in Ebonyi State, doctors in that state had to move to the streets to protect that this Ebonyi doesn't have a functional virology center. And of course, this speaks to other states majorly across the country. It just betrays that point. Now, why does it seem that it takes an emergency situation in the health sector most of the time for that sector, first off, to be given attention and for the right thing to be done?
Yeah, so I do. It was a very unfortunate situation in Ebonyi State. I just returned from Ebonyi myself. I went to see the Chief Medical Director and the Honorable Commissioner for Health. You know, it's really a tragedy when the colleagues that are working so hard, doctors in this instance, to protect Nigerians, actually lose their lives while working. So we're working at the moment. It's like I said, it's a complex lab to set up for Lassa fever. Actually, the Ebonyi State government is one of the model states in this country because they're working together, hand in hand with the Federal Medical Center in Abakaliki. It's very rare that you find state governments and federal medical centers and university teaching hospitals really working together and investing together in the facility. So they've invested in the facility. It's work in progress. We're already managing patients there. At the moment, we are setting up the diagnostic facilities. I think among the other zones, the Southeast will be the first, in addition to the existing centers, to set up a Lassa fever testing center. They have called theirs a virology center. So yes, progress has been slow, but I do agree with you. Sometimes it takes a crisis, and always I say we should never miss the opportunity that a crisis provides. And I think right now in Ebonyi, even in the last week ago, we have made a lot of progress, and what is really satisfying is that we are investing, the state government is investing, the teaching hospital itself is investing, and all of us are working together to provide the people of Ebonyi State a center that will be able to detect Lassa and support the treatment.
All right, talk to us before we go. Is there any deliberate strategy to wipe out some of these epidemics that keep resurfacing year on year on? Say 2-3 years, we'll be able to get rid of all of this. Like we had a very deliberate drive in kicking polio out of Nigeria, and it's been a very commendable effort in that regard. Is there any deliberate strategy or policy towards that kind of thing to eradicate all of these from Nigeria?
Yeah, the current government in Nigeria, led by President Muhammadu Buhari and the current Minister of Health, Professor Isaac Adewale, I think more than ever before, public health has been prioritized in our context. A very vibrant team of leaders were appointed to 5 critical health agencies, and we're working together really to address some of these issues. Now, for some diseases, like yellow fever, for instance, we have a vaccine. So for infectious diseases where there's a vaccine available, this provides the best tool for the work that we do. And the National Primary Healthcare Development Agency, like we've heard, is prioritizing routine immunization, prioritizing campaigns. For all the others, we need to really step up our detection and ultimately control. And we're doing this by digitalizing our surveillance architecture at the moment. This is being led by the Nigeria Center for Disease Control. We're improving our labs. But I really want all of us to come together. Like I said, you know, fighting infectious diseases is not Ebola was a unique situation. You had a new disease introduced into Nigeria by a single passenger. But for all the others, this is endemic in our environment. So there's no simple solution that can wipe everything away. It's a deliberate attempt. It needs to be done consistently over many years. And so I'm really appealing to Nigerians to support us on this journey, because it will be a long journey, but we are absolutely determined to continue moving and get us to a point, if not elimination, at least a reduction of incidence of all the diseases.
Yes, you said you said that this administration has been doing a lot for education, and it's 2017 in the budget, about 1,688 naira, if broken down, was allocated for each citizen of the country in the health sector to take care of their health for the whole year. Now, of course, apart from this administration, it's been a recurring problem that the health sector is never given enough attention as required. So what should be the focus now, moving forward, so that that can be more vibrant as compared to other countries on the continent?
Yeah, as a principal leader in the health sector, I can't but advocate for more funds for the sector, because I see the impact of not investing enough in the health of our people every day. And whether I'm traveling to Ebonyi State or Zamfara State or Ondo State, I see the impact every day of inadequate investments in the health sector. At the same time, I'm a citizen of Nigeria. I see the bad roads. I see the need for investing in infrastructure. We're all crying about electricity. So it's not easy wearing the cap of the president where you have to allocate our funds to the different sectors because we have so many multiple needs across the country and areas that require development. But there's absolutely no doubt about if you're not alive, you can't drive on the road, you can't put on your light switch, you can't put on your tap. So the first requirement in any society is to keep its citizens alive. And that's why we really keep advocating for increased investments in the health sector. The one commitment that the current leadership across the health sector can make is that we will invest every naira we're given efficiently and effectively to improve the health of Nigeria.
All right, there are so much concerns about urban planning, the way housing policies are and how houses are built that affects the environment one way or the other. And since there is no uniformity and government doesn't really have a plan that people are working with, everyone's building his house the way they want. And that leads to the kind of environment that we won't want. So is the government going to, are you going to put that to the government to start looking at that? Because the rats, it seems they are here to stay and they are building their own houses too.
Yeah, absolutely. You see, public health is a very complex context because very little of it is actually dependent on health services per se. We need Ministry of Works to come to the party. We need Ministry of Water Resources. It also depends on people's socioeconomic status and opportunities to earn a living and to work. But I think the first thing is really to raise the awareness among people. There's a lot that we can do ourselves. If the gutters are filled to the brim in front of our houses, we don't need to wait for government to come and empty the gutters that are filled right in front of the houses that our children live in. So I really am appealing to people to, while government is doing what it can do at the federal, state, and local government levels, let us all do our bit. Let's organize our streets. If there's a heap of refuse on a street that we are living on, you know, we don't need to wait for government to come and get that heap away. They will come when they can.
Okay.
And we're pushing them.
All right.
We come to the party as well.
All right, Dr. Chike Ihekwazu, as the CEO of the Center for Disease Control in Nigeria, thank you so much for talking to us.
It's been an absolute pleasure.
It's time for the news update now.
Yes, absolutely.
Shortly.
Yes, that will come your way shortly after this.